What if that small wound on your foot is actually the first warning sign of something that could cost you your leg? What if your body has been warning you about diabetes and you've been ignoring it every single day? Not after a lab test, not after a doctor's visit, but quietly, consistently, long before any diagnosis is ever written on paper. Now here's the part most people never realize. Some of the earliest warning signs don't show up in your blood work first. They show up in a place you look at every day, but rarely pay attention to: your feet. I know that may sound surprising. Most people believe diabetes begins and ends with a blood test. You go in, get your numbers checked, and only then do you find out something is wrong. And I understand why people think that. For years, many of my own patients believed the exact same thing. My name is Dr. Miller, and I've been practicing medicine for over 20 years. And if there's one pattern I've seen over and over again, it's this: the body always whispers before it screams. The problem is, those whispers are often subtle, easy to dismiss, and dangerously easy to misunderstand, especially when they appear in the feet. I can't tell you how many patients have walked into my office, or worse, into the emergency room after months, sometimes years, of clear warning signs. Not because they didn't care about their health, but because they simply didn't know what they were looking at. Just last month, I sat down with a 7-year-old patient, retired, active, no major complaints. He told me he felt fine. But as we talked, I asked him a simple question: have you noticed anything unusual about your feet? He paused, then said, "Well, they've been a little numb lately. I thought it was just age." That one detail changed everything. Before we even ran his blood work, I already suspected what was coming. When the results came back, his fasting blood sugar was 214. He had diabetes and had likely been living with it for over 2 years without knowing. What shocked him the most: he already had 4 of the 9 warning signs I'm about to show you. So today, I want to show you exactly what I showed him: 9 early signs your feet may be giving you right now. And as you listen, I want you to ask yourself one simple question: how many of these have you already noticed? Now, let me show you the very first sign, one that almost every patient I've seen has experienced, and almost every single one has explained away. That tingling, that numbness, that pins and needles feeling in your feet. Most people tell me the same thing: "Doctor, my foot just fell asleep. I was sitting too long." And yes, that can happen occasionally. But here's the question I always ask: is it happening more often, even when there's no clear reason? Because when it becomes frequent, that's no longer just pressure on a nerve, that's something deeper. What's actually happening inside your body is something called peripheral neuropathy, one of the earliest effects of elevated blood sugar. Excess sugar in your bloodstream begins to damage the protective outer layer of your nerves. I often explain it like this: imagine your nerves are electrical wires, and each wire has a protective coating. When blood sugar stays high, it slowly wears down that coating, like acid eating through insulation. The signal still travels, but it becomes distorted, unstable. And that distortion is the tingling you feel. I remember one patient who ignored this for months. By the time he came in, the numbness had spread across both feet. His blood sugar had been elevated far longer than he realized. So here's what I tell every patient over 60. Start walking 20 to 30 minutes every single day. Not next week, today. And begin cutting back on added sugar immediately. Because the earlier you act, the more you can protect those nerves before the damage becomes permanent. Now, let's move to sign number 2, and this is the one many patients describe as the most unsettling, because it doesn't bother them during the day. It shows up at night, when everything is quiet, and there's nothing to distract from it. A burning sensation in the feet, especially when you're lying in bed. Most people assume it's simple. I was on my feet all day. Maybe it's the heat. I'm just tired. And sometimes that's true. But when that burning feeling becomes frequent, especially at night, I start to pay very close attention. Because what's actually happening has nothing to do with heat from the outside. It's coming from within. When blood sugar remains elevated, it begins to damage the nerves in your feet, And instead of going numb, some of those nerves start sending the wrong signals. I often explain it like this. Imagine a fire alarm with a faulty sensor. There's no fire. Nothing is burning. But the alarm keeps going off anyway. Not because there's danger outside, but because the system itself is damaged. Your nerves are doing the same thing. They're sending a heat signal to your brain, even though nothing is there. I've had patients tell me this kept them awake for weeks before they finally came in. So here's what you can do starting today. Drink enough water, at least 8 glasses a day, and begin adding more fiber to your meals. Vegetables, oats, legumes. Because stabilizing your blood sugar is the first step to calming those overactive nerves. Now, sign number 3, and I need you to pay very close attention here, because this is where things stop being uncomfortable and start becoming dangerous. A small cut, a blister, a sore spot from your shoe that just won't heal. Most people don't think twice about it. It's just a minor wound, they say. It'll close on its own. And under normal conditions, that's exactly what happens. The body repairs itself quickly and efficiently. But when blood sugar has been elevated for a long time, that healing process begins to break down. Here's why. High blood sugar damages your blood vessels, especially the tiny ones in your feet. Over time, those vessels become narrow and stiff. And when that happens, oxygen, nutrients, and immune cells, the very things your body needs to repair tissue, can't reach the wound properly. I often explain it like this. Imagine you're trying to water a garden, but your hose is tightly kinked. The water is there, ready to flow, but it can't get to the plants. That's exactly what's happening inside your body. The healing resources exist, but they're blocked from reaching where they're needed most. And that's when a small wound becomes something much more serious. I've seen patients come in with a tiny blister they ignored for weeks. By the time they sought help, it had turned into an infected ulcer. In severe cases, this can lead to tissue death and even amputation. And the most heartbreaking part? It often started with something completely preventable. So here's what I want you to do starting tonight. After your shower, sit down and check your feet carefully. Look at the soles, the heels, and between every toe. If you see any cut, blister, or open skin, clean it immediately and protect it. And remember this rule. If it doesn't improve within 48 hours, do not wait. Call your doctor, not next week. Within 48 hours. Because when it comes to your feet, early action can mean the difference between simple treatment and life-changing consequences. Now, sign number 4 is something many people see every single day, but almost no one connects it to blood sugar. Changes in the color of your skin, especially around your feet and ankles. Some patients tell me, it's just sun exposure, or my skin has always been a little darker there. And sometimes that's true. But there's a specific kind of discoloration I look for areas that appear darker, reddish, or even slightly bluish. Because this isn't just about skin, it's about circulation. When blood sugar remains high, it begins to damage your blood vessels, making it harder for oxygen-rich blood to reach the farthest parts of your body, your feet. Without enough oxygen, the skin starts to change color. It's not random, it's a signal. I often explain it like this. Imagine your bloodstream as a delivery service, carrying oxygen and nutrients to every part of your body. Your feet are at the very end of that route. When the roads your blood vessels become narrow or damaged, the deliveries don't arrive on time, and when that happens, the skin begins to show it. So here's a simple habit you can start today. Spend just 5 minutes each morning doing ankle circles, toe raises, and gentle calf stretches. That small movement can help improve blood flow to your feet and over time make a real difference. Now, sign number 5, and this one surprises almost everyone because at first glance, it looks completely harmless. Cracked heels. Most people immediately say the same thing. It's just dry skin. And yes, mild dryness is common, especially as we age. But when those cracks become deep, painful, or don't improve no matter how much lotion you use, that's when we need to look deeper. Because this isn't just a skin issue, it's a nerve issue. High blood sugar can damage what we call the autonomic nerves, the ones responsible for automatic functions in your body. including moisture control in your skin. When these nerves are affected, your sweat glands stop working properly. Your feet begin to lose moisture from the inside out. I often explain it like this. Imagine your skin as a protective wall. When everything is working, that wall stays strong and sealed. But when those nerves are damaged, the structure begins to weaken. Small cracks appear, and over time, those cracks can deepen. And here's the real concern: those cracks are not just cosmetic. They are open doors for bacteria. In feet with poor circulation, even a small infection can quickly become serious. So here's what you can do. Moisturize your feet every night before bed, focusing on the heels and soles, but never between the toes. And just as important, stay hydrated. Your skin needs moisture from within. Now, let me ask you something. Have you noticed any of these signs so far? Even one? If you have, type yes in the comments. Just yes. Because the first step to protecting your health is recognizing what your body is trying to tell you. Now, sign number 6. And this one is more serious than most people realize, because it's not just about your feet. It's about what may already be happening inside your body, especially your kidneys. Swelling in the feet and ankles. Almost every patient I ask about this gives me the same answer. I've been on my feet all day, or I sit too long at work. And, to be fair, occasional swelling from activity can be completely normal. But when the swelling becomes consistent, when your shoes feel tighter every evening, or you notice deep marks left by your socks, that's when we need to pay attention. Because this kind of swelling is often not about movement, it's about fluid. When blood sugar stays elevated over time, it begins to damage the kidneys, the organs responsible for filtering your blood and maintaining fluid balance. As kidney function declines, your body starts retaining excess fluid. And where does that fluid go? Downward, to your feet and ankles. There's a simple way to recognize this. Press your finger gently into the swollen area for a few seconds. If the indentation stays there briefly after you lift your finger, that's called pitting edema. And it's a sign your body is struggling to regulate fluid properly. I remember one patient who ignored this for months. He thought it was just part of getting older. But when we finally ran tests, his kidney function was already significantly affected. The swelling in his ankles had been an early warning sign all along. So, here's what you can start doing today. Whenever you're resting, elevate your feet slightly, just a few inches above heart level if possible. This helps fluid move back toward the center of your body. And just as important, begin reducing your salt intake. Excess sodium causes your body to hold onto even more fluid, making the swelling worse. Small changes, done early, can make a meaningful difference. Now, sign number 7, and this is one I see misinterpreted all the time, especially in older adults. A sharp, sudden pain in the feet, often described as an electric shock, a stabbing sensation, or even a burning needle. Most people assume it's something mechanical. It must be arthritis, they say, or maybe an old injury acting up again. And sometimes that's true. But when this kind of pain appears without clear cause, especially at night, we need to consider something else. Nerve damage. When blood sugar remains high over time, it doesn't just dull the nerves, it can make them unstable. Instead of going quiet, some nerves begin to fire randomly, sending intense pain signals to the brain, even when nothing is actually wrong in the tissue itself. I often explain it like this. Imagine a car alarm that's been damaged. No one is touching the car. There's no danger. But suddenly, the alarm goes off loudly and unpredictably. Not because of a real threat, but because the system itself is malfunctioning. That's what your nerves are doing. They're sounding an alarm, even when there's no injury. And here's the problem. Painkillers don't fix this. They may dull the sensation temporarily, but they don't address the root cause, which is nerve dysfunction. So instead of masking the signal, support your body. Each morning, spend a few minutes gently stretching your feet and ankles. And at night, try a light massage along the soles and around the ankles. These simple habits can help calm irritated nerves and improve circulation over time. Now, sign number 8, and this is one that many people have lived with for years without ever questioning it. Cold feet. I hear it all the time. Doctor, I've always had cold feet. Some even joke about it, how they need extra socks, or how their partner complains every winter. And in many cases, that's harmless. But here's the question I always ask. Are your feet cold even when the room is warm? Even under blankets? Even in the middle of summer? Because if the answer is yes, that's no longer just a comfort issue. That's a circulation issue. When blood sugar stays elevated over time, it begins to damage and narrow your blood vessels, and your feet, being the farthest point from your heart, are the first to feel the effects. Warm, oxygen-rich blood simply can't reach them in the same way anymore. I often explain it like this. Imagine your body has a heating system, with pipes carrying warmth to every room. Your feet are the last room at the end of the line. When those pipes become narrow or blocked, the heat never fully arrives. The rest of the house may feel warm, but that room stays cold. So what can you do? Start with one simple habit: a brisk walk every day. Not a slow stroll, but a purposeful walk that gets your blood moving. Even 10 to 15 minutes is a powerful start. Now, sign number 9, and this is the one almost nobody talks about. In fact, most people don't even notice it until it's pointed out to them. Hair loss on your feet and lower legs. At first, it may not seem important. Many patients look down and say, "I never paid attention," or maybe it's just aging. And that's exactly why this sign is so often missed. It's quiet. It doesn't cause pain, but it tells a very important story. Because hair doesn't just grow on its own, it depends on a steady supply of oxygen and nutrients delivered through your blood vessels. When blood sugar remains high over time, those vessels begin to narrow and weaken, and as circulation decreases, your hair follicles stop receiving what they need to function. I often explain it like this. Imagine a garden with a slow, weakening irrigation system. At first, everything looks normal. But as the water supply decreases, the plants don't die overnight. They simply stop growing. Gradually, the garden becomes bare. That's exactly what's happening here. Hair loss in this area is not just cosmetic, it's a visible sign of long-term circulation problems, a signal that blood vessel damage may already be progressing silently. So here's what I want you to do next. Take a moment and look at your lower legs and the tops of your feet. If you notice thinning hair or areas where hair has disappeared entirely, don't ignore it. Schedule a blood glucose test this week, not later this week. Because sometimes the quietest signs are the most important ones to catch early. We've reached the end, but in many ways, this is the most important moment. Because what you've just seen are not just random symptoms, they are signals. 9 signs, and more importantly, 9 opportunities to catch something early. 9 chances to see what most people miss until it's too late. After more than 20 years in medicine, I can tell you this honestly. The most difficult part of my job is not diagnosing diabetes. It's sitting across from someone who has had these exact signs for months, sometimes years, and simply didn't know what they meant. They cared about their health, they paid attention, but no one ever showed them what to look for. Now, you know. So here's what I want you to do next, and I want you to keep this simple. Tonight, before you go to bed, take just 30 seconds and look at your feet. Look closely. Check the skin, the heels, between your toes. Notice anything unusual, numbness, color changes, cracks, swelling, anything that doesn't feel right. 30 seconds. That's all it takes to start protecting yourself. And if you notice even one of these signs, don't wait. Call your doctor tomorrow, not next week, tomorrow. Ask for a simple blood glucose test. In many cases, it costs around $12. And that small step could give you clarity, direction, and the chance to take control early. Because this is not just about avoiding a diagnosis. This is about protecting your independence, your ability to walk, to move freely, to live your life without limitations. Don't let something as manageable as blood sugar slowly take that away from you, just because the warning signs were overlooked. If this helped you, share this video with someone you care about, a parent, a partner, a friend. Tag them, because this information could matter more than you think. And if you want to stay informed, stay aware, and stay one step ahead of your health, subscribe to the channel. Take care of your body. And start today.